Marty Bulagan.
Today,
So I am Michelle and I will be your student nurse for today. How would you like me to call you?
just Marty.
Okay, that's great. Let me just double check a few of your information. So how old are you?
I'm 24.
Okay. Where do you live?
I live in Muntinlupa City.
When's your birthday?
On August,
Okay. Are you married?
in a relationship
Okay, great.
with
So
someone.
let's get on with the interview. Is it okay if you
Yes.
start now? Okay. So what brings you here to the clinic?
I've been having a headache.
Okay. When did this headache start?
2 days ago.
2 days ago. If you were to point to me the area where it occurs, could you please point it to me? So it hurts in the middle right
Yes.
here. Okay. So does it only occur in that area?
Yes.
Does it hurt anywhere else?
Yeah.
Okay. So if you were to describe the headache for me, how does it feel like? Is it like throbbing? Is it radiating? Sharp? Knife-like?
Yes, I feel sharp pain.
Okay, so it's like sharp pain in the middle. Okay, so if you were to rate the pain from a scale of 1 to 10, with 10 being the most painful and 1 being the least, what number would you give me?
8 to 10.
So it ranges from 8 to 10.
Yeah.
Okay. How long does this headache last?
Around 5 to 10 minutes.
5 to 10 minutes. Does your headache come and go, or is it kind of persistent?
It comes and goes.
So what are the events that triggers your headache? Like what were you doing at that moment when it occurred?
It hurts when I'm using my phone.
So may I just ask, how long do you usually use your mobile phone?
5 to 6 hours like that.
5 to 6 hours. Do you rest in between those 5 to 6 hours?
Yes.
Okay. What makes your headaches worse? Like the weather, any food, medication?
When it's hot,
Uh-huh.
it gets worse.
So when the weather is hotter, it gets worse. What are the things you do to lessen or ease the pain? Such as, do you rest? Do you drink
I
anything?
rest.
Okay.
Rest.
So you rest. Do you take any medications
No.
for the headache? No. So you just rest for it. So, Marty, besides the headache, do you feel any other discomforts?
I don't think so.
Okay. You don't have any cough,
No.
a runny nose?
No.
Any nausea? Do you have trouble sleeping?
Sometimes.
Okay. So, when you have trouble sleeping, what do you take? Or do you do anything to help you sleep?
I'm just drink water.
So you just drink water. Okay, so thank you for that. Okay, so Marty, for the next part of this interview is about your past health history. Just a few questions about your past. Is it okay with you?
Yes.
Okay. So as an adult, could you recall back your childhood about any illnesses, any childhood illnesses? Like chicken pox, mumps, strep throat.
No, I don't know.
Okay, so you
I
don't
don't know.
recall.
Yeah.
So, have you asked your parents before if you've had any immunization or vaccine as a child?
Yes, I asked. Okay.
So, do you recall the immunization or
I
vaccine?
don't know. I don't remember.
Okay. So, do you have any medications that you take every day?
Only vitamin C I take.
Okay. Just vitamins?
Vitamin C.
Okay. So, do you recall any surgeries?
No,
Have you had any?
I haven't.
Okay. So, have you ever had any serious injuries that needed you to go to the hospital or seek medical care?
I haven't.
Okay, that's good. So, have you ever been to the hospital again besides when you were born?
I haven't.
Okay, that's good actually. Are you up to date on your vaccines or your immunizations?
Yes.
Okay. So, are you allergic to anything else? Any food, drinks? So you're not allergic to anything. Okay. So now I'm gonna ask a few questions about your family background, or if there are any diseases present in your family. So, do you have any family member that has any diseases or any illnesses?
No.
That's good. So, they don't have like diabetes,
They don't.
tuberculosis.
They don't.
Is there anyone in the family that's epileptic?
No one.
How about someone with asthma? How about cancer?
No.
Any mental disorders?
No one.
Hepatitis?
No.
Heart diseases?
No.
So there are none.
Yeah.
Okay, that's good. How do you feel about yourself today?
I'm good.
Okay. So do you feel any discomfort
No.
besides your headache? Okay. So may I know who you're living with?
I'm living with my parents.
Okay, so still in the care of your parents?
Yeah.
Do you have any problem doing any activities?
I don't.
How about moving around? Do you have any difficulties?
No.
So do you exercise?
I don't.
You don't exercise. You've never tried exercising?
I tried twice.
Twice. Okay. So how do you find doing exercises?
It's good.
Okay. Can you sleep with ease? Do you have any problems sleeping at night?
No. I can sleep.
Okay, so you can sleep with ease. Do you eat regularly?
I eat regularly.
Like 3 times a day?
Yes.
You don't skip meals?
Yes, I don't sleep.
Okay. So what type of food do you usually eat?
Rice. I usually eat rice every day.
Do you smoke?
No.
Do you drink any alcohol?
I don't.
Okay, that's good. How about work? Do you work?
No.
Do you still go to school?
Yes.
Okay. May I know what your hobbies are?
I'm just playing with my phone.
So you like playing with your phone. So on a daily basis, you usually use your phone.
Yes, I play
Okay.
games.
So may I know the languages you speak?
Tagalog and English.
Okay. So are you in a relationship with someone? Intimate relationship with someone?
Yes, I have a girlfriend.
Okay. So how about any organization participation in the community? Are you in any of those?
No.
I'm just gonna ask a few questions about your home. Do you own a house?
Yes.
Okay. Does it have any restroom?
Yes.
Okay. How about the water supply? Is it Maynilad or a deep well?
It is deep well.
Okay. But you don't have any trouble with the water?
I really don't have
Okay.
trouble.
You don't drink from it?
No.
Okay, that's good. How about electricity? Do you have
Yes.
electricity?
Yeah.
Okay. How about your mode of transportation? How do you go to school, home, or anywhere
Commute.
else? Okay, so
Jeep.
you commute. You ride a jeepney.
You're right. Yes.
Okay. So now I'm gonna ask about your weight. This is the last part of the interview. Okay, just gonna clarify some of the things if you missed anything. It's okay. How about your weight? Are you happy with your weight?
Yes, I'm happy.
No sudden weight loss?
No problem.
Okay, so you're happy with your weight. That's good. So do you have any skin problems?
No problem at all.
Okay. How about any rashes?
No.
No? Okay. Itchiness or pain?
No.
None. How about any change in your hair? Do you have hair loss?
No.
Hair lice? No. So
No,
you have
yeah.
healthy hair. How about your nails? It's
No,
good?
I don't.
Okay.
No.
How about your eyes? Do you have a clear vision?
I have blurry eyes.
You have blurry eyes. You have blurry vision. Have you gotten your eyes checked before?
No.
No, you haven't.
I haven't.
But do you have a hard time seeing things, like reading?
When I'm reading,
Okay. When you're reading things that are far, or
when it's far, I don't see.
okay. How about any pain in the eye?
No.
Any dryness? Any tearing or blindness? No. So you just have a blurry vision and you haven't gotten your eyes checked before. Okay. So any complaints of runny nose?
No.
Okay. Have you ever had like bleeding nose?
No.
Okay. How about your ears? Do you feel any ringing?
No, there's no problem at my ears.
Okay, that's good. How about when it comes to speaking? Do you have a hard time?
I don't have.
Okay. So how about any heart problems? Do you feel chest pain? Any heartburn? No? Okay. Do you sometimes feel your heart beating too fast, like it's gonna pop out of your chest?
No.
Okay. No palpitations?
No.
Okay, that's good. So, do you feel like vomiting at times? Are you nauseous?
I don't feel that.
Okay, no heartburns.
No.
No. How about difficulty swallowing?
No.
Okay. Do you feel constipated?
No.
Diarrhea? So you don't feel any of this? So no discomforts, no other problems. So okay, I'm just gonna restate what you said to me. So you've been having a headache for almost 2 days now. The pain is around 8 to 10. That's right. So the headache occurs when you're using a mobile phone,
Yes.
and then you try to rest to ease the pain.
Mm.
Okay, that's good. So that's it for the interview for today. So we're just gonna call you for the next interview or any other test. So thank you very much, Marty.
Thank you so much.
Thank you.